Ohayou gozaimasu. Good morning for everyone. Today I'm going to talk about a part of my PhD thesis, non-invasive mechanical ventilation on CPAP mode on premature calves for neonatal hypoxia treatment. So let's introduce myself. I'm from Brazil, so far away from here, from São Paulo state. And I've done my master and my PhD on Pirassununga at the University of São Paulo, and now I'm professor of this uni. So we are famous about our university, about our Air Force Academy, and about our Brazilian cachaça, our spirit drink for sugarcane. So let's talk about the calves. So with the increase of this production, embryo transfer, cloning, transgenic animals, we have a period of abnormalities on health and offspring during the pregnancy of the postnatal life. So monitoring this kind of animal becomes necessary with the advancement of the biotechnology of reproduction. So what's going on with these cloned calves? The most of one have cardiovascular disease, perturbed immune system, and the syndrome of gigantism, and another defects, including high postnatal mortality. The mortality usually is about 50%. So why they're doing this? To animals that have died early, or they're not available to the reproduction, or for prolonged perpetuate and expand the genetics of the superior animals to a stock or a breed, so to a genetical enhancement. And that's why our group is contributing to the cloning studies and the development of veterinary neonatology. So, unfortunately, we have not much information in the literature. That's why we're looking for a study more about neonatal adaptation period, intrauterine life, external environment, and cardiorespiratory adaptation. So at the birth, with the interruption of the fetal placental circulation, the fetus are subject to hypoxia and hypercapnia. And the main causes of these mortalities, according to Blue, are respiratory and metabolic disorders. So for a success of this neonatal adaptation, we need establishment of a pulmonary circulation, a reduction of the pulmonary artery pressure, and to correction of the base values. So the advantage of non-invasive mechanical ventilation is to improve oxygenation, decrease the respiratory work, and have a spontaneous ventilation of the patient. So there's not much information about these ventilatory supports for calves. So the objective then of this study was to check the influence of non-invasive mechanical ventilation on CPAP mode. So to evaluate this condition, we took arterial blood gas analysis and evaluated the hemodynamic values, including the pulmonary artery pressure and the cardiac output. So we used 12 premature calves. They are very similar to the cloned calves. Unfortunately, the clones are really expensive to use, so our model is premature calves, and they are very similar, the cloned. So we've done a cesarean section of 12 Nelore cows, about 75 days of gestation, using a Vita ventilator on CPAP mode and using the mask. And we are sure these animals at birth had acidosis, hypercapnia, and hypoxia. So that's our material. We have this Evita ventilator, the face masks. Depending on the size of the animal, we can choose. Is the similar we use it in dogs. We have the iStat to evaluate the blood gas analyzers. We have a multiparametric monitor, and we have the Swan-Ganz catheter that we insert in the jugular and goes to the right side of heart. So that's our dams. We use these animals. So these Nelore have been in the pasture all life, and they just came from the pasture a month before the cesarean section. And we have two ventilatory procedures. So the first time, we change in the ventilatory using the fraction of inspired oxygen. So we started with 21. 21 is the fraction we have in the environment. After 15 minutes, we increase to 28, and they are similar to the nasal catheter. After that, we increase to 50%, and then finish with 100%. After that, we've done the recruitment alveolar, increasing the PEEP. PEEP is the positive and expiratory pressure. So this PEEP usually is -1. So we increase in the ventilatory equipment. So we start with PEEP 0, then increase to 5, to 10, and then to 15. So if you're not, you never knew about the PEEP, that's what happened with the lung in alveolar recruitment. So we have some areas that is not having the change of the gas with the collabed alveolar. So increasing the PEEP, we can have more area to change the gases, and that's what happened in this procedure. That's our animals. The first question if these animals stay comfortable with the mask, because the babies, human babies, usually have problem with to use this kind of mode about the mask, but the animals is pretty good with the mask. We don't have any problem. We put a tape to fix it, the mask in the face. That's another animal. One more cloned calf. And here showing the hemodynamic evaluation with the Swan-Ganz catheter at the jugular. And in the finish of this ventilator, we keep this animal with a nasal catheter. To be safe, this animal is okay to breathe without the mechanical ventilation. So our results. So in the beginning of the study, immediately after birth, we check the blood gas analysis. So the mean of these animals of about pH is about 7.2. The normal is about 7.45. The dioxide carbon is 55, and they should be lower than 45. The oxygen pressure is about 33. Usually they should be higher than 60. The base excess is around 5.4, and there's normal. It's usually -5 to 5. The bicarbonate is 22. Usually they are around 28. And the oxygen saturation is 43 in these animals, and usually they should be higher than 98. So we are sure these animals have acidosis, hypercapnia, and hypoxia at the birth. So after we increase the fraction of oxygen inspired, we can see an increase of the values of oxygen pressure. So they started with 52 when have 21% of oxygen, and with 100% of this fraction, we have 253. And the oxygen saturation begins with 74, 77, and then we finish with 98. So we see the increase of the oxygen in these animals, increasing the oxygen fraction. About the hemodynamic variables, we checked the pulmonary artery pressure. So they are at the birth with these higher values, like the cloned calves. So they are with 52. And in the end of the ventilation with 100%, they are decreased to 45, showing the decrease of the pulmonary artery pressure indicates the decrease of a pulmonary vascular resistance and the homeostasis improvement. So we can check in the graph as well. And nothing happens with the cardiac output. So increasing the PEEP, we can see the same as increasing the oxygen fraction. So we can see the oxygen pressure with PP0, 72, and they are increasing at PP15, 106. And the oxygen saturation, we have 88, and in the end of the study, we have 96. And nothing occurs with the hemodynamic variables, so showing it's safe to increase this PEEP till 15. So we conclude non-invasive mechanical ventilation on CPAP mode, increase the oxygen fraction or the PEEP, help to ventilate preterm cows with neonatal hypoxia. and fraction of oxygen inspired of 15 to or 100 has an effect on the pulmonary artery pressure reduction. And the increase of PEEP up to 15 show to be safe and increase the improvement of oxygenation. So in the end of this study, after a lot of cesarean section, we show this protocol in case of dystocias or cesarean. So for the reanimation protocol, first after calving, we take this calf, cutting and disinfection the cord umbilical. Then we are looking for the airway expansion, so we put this animal down and make a massage on the thorax. We give a bath of cold water, and then with this cold water, he can give a huge inspire and giving this airway expansion. If this animal is still with hypoxia, we can give a doxapran shot, or in the bradycardia, we have good results with the atropine. If this animal didn't respond, they move then to the mechanical ventilation, starting with CPAP mode, using the mask, and after that, doing the alveolar recruitment, increasing this PEEP. If he didn't respond, we put him in the intubation mode. So, and after that, we can finish controlling the temperature and giving some colostrum for him. So to finish, I'm just want to invite to all guys to come to Brazil and enjoy our natural beauties. And that's all. Thank you very much.